It's Wendy Bowen, physiotherapist with Know Your Body Better. So we're going to talk about the psoas muscle. Do you have a tight psoas? The psoas muscle is a really common muscle for getting tight, hypertonic tension. And it runs from our lower back down in here, so it attaches in here, comes down into this inner hip bone right there. So what happens, it is a bit of a hip flexor, okay? So when we lift the hip up, it does flex the hip, but it is also, you can see from its attachments, a lumbar or spinal compressor. So when it gets tight, it pulls your spine down like this. So if you have a tight psoas muscles both sides, it's going to really compress your spine down. And if it's just one side, you're going to end up with a little compression on this side here. It's a very hard muscle, seems to be a hard muscle to get to release as well. Now, how do you know your psoas is tight? Well, we have a test that's called the Thomas test. Now, if you can do this, what you're going to do is kind of sit with your buttocks on the edge of the bed, lie back, grab one knee all the way up to your chest so your back is flat on the bed, and drop this down. Now, if you can see, I'm not quite level with the bed or passing that. So on this side, I have a tight psoas. If I do it on the other side, I don't know if you can see that, but it doesn't drop as much. So my left side is much tighter. Now you can do those nice hip flexor stretches. You know, the one I like for the front of my hip is, oops, hang on, we drop in that. This hip back up nice and tall, don't overarch your back, and lunge forward. So that can give us a nice stretch through the quad and the hip flexor muscle. The other one that I really like, and this is easy for some people to do, is if you're lying on your back here, you flatten your back down, so you're doing that nice pelvic tilt, and then you slide one leg down, trying to keep that pelvic tilt. You can stretch out the front of the hip there, and then you do the other side. So flatten the back, get the pelvic tilt, and slide down as far as you can. And this one doesn't go as far again, so I'm tight in that psoas muscle. So remember, the psoas muscle can get really tight. Your massage therapist, chiropractor, physiotherapist will often dig in your abdominal area to try to release it. You can add these stretches in to try to get it more mobile, so it's not compressing your spine. Because the more you compress your spine, the more likely you are to get some nerve impingement. So it's Wendy Bowen with Know Your Body Better, talking about the psoas muscle.